We're joined here by Alan Stevens, the Head of Strategic Engagement at the Institution for Occupational Safety and Health. Thank you again, Alan.
Good to be here.
We were speaking now off camera about the duty to care, and if we really take an interest in people and their health and their safety and just generally care about people, we would want to naturally comply and make sure that we get all the boxes ticked, which generally is a negative perception around health and safety as well. I really enjoyed your topic this morning. I've got a few questions with regards to that, if you don't mind. In your presentation, you shared with the delegates the focus that IOSH is placing a large focus on small and medium-sized enterprises, as well as the informal sector. What was the motivation for the shift to take place?
Yes. Well, I think it's data-driven. It's so easy to focus on the large organisations, and it's really important that we do, because at the apex of any supply chain, they can influence things. But the reality is, workplace harm is most acute in small businesses, micro businesses, particularly in sectors such as agriculture, textiles, garments, things like that, that fragment really quickly into very, very tiny businesses. You know, we know where harm's occurring, we know why it's occurring, we know how to fix it. We've just got to get the focus on those that are hardest to reach. I think at times there's a tendency to move towards the larger settings because we can claim in one initiative that we've trained 1,000 people, or we've done things on scale. But the reality is the real harm's occurring in a fragmented environment. You know, you look at it, if you think of some of the famines and some of the tragedies away from OSH, the Ethiopia, Somalia kind of hunger of years ago, and Live Aid came out of it. But if you look, the amount of people that died in those famines was the same as the amount of people, roughly, who die every year across the world because of OSH. But it's so fragmented, it's so dispersed, that it doesn't capture the attention. So it's those small businesses where people get hurt, get sick, that go under the radar. And then the most important thing as well, I think, is the support or the lack of that they get. Whereas big organisations, they'll have wage support schemes in place, typically as well, death in service benefit, things like that. The micro businesses, again, particularly in industries such as agriculture, textiles and so forth, there's very little safety net. So if it goes wrong, it goes catastrophically wrong. And if most of those people that we see in sub-Saharan Africa are just about managing anyway, anything that happens that gets in the way of their ability to work pushes them below the survival line. Where do they get their money from? From lenders in Ghana at the moment. The lending to small businesses, the interest rate's over 30%. They're never going to pay these loans off. So that means they have to make sacrifices, and typically it's the kids' education that goes and so forth, which then spirals down again into this suppression of economic development.
And that becomes a generational issue as well, where the next child or grandchild wouldn't be able to thrive as they could have, should circumstances have been controlled efficiently.
Absolutely right.
And I think that's become very much systemic as well, where if you consider health and safety, you think about risk assessments, templates, documents, health and safety officers' appointment letters, all of these things that are legislated to be done. But we rarely think about the person sitting on the sidewalk with a little bit of a fire going, making vet cook for a person that's passing by on their way to a factory. And the exposure that they have consistently towards the chemicals or the substances that they're working with. We don't think about it that way.
And when you think about the emerging trends, the emerging risks, you're so right. In sub-Saharan Africa, you have rapid urbanisation combined by the traffic that comes with that. So you have a car, you can't afford a car because you're just a normal worker. If you want to get on a bus, the buses go so slow because they're stuck in traffic. So the only way you can get to work is typically on a motorbike. Those motorbikes, if you're riding those motorbikes, or if you're an Uber delivery driver, you see them all across the world and here in Africa. They're on the streets, breathing those kind of bad air conditions all day long. But then the motorbike taxi drivers, they're taking a passenger on board, right? And if you look in, particularly in Commonwealth East Africa, Uganda, Kenya, Tanzania, hardly anyone wears a crash helmet. It's not enforced. And if you think, I'm not. It's mad. It's absolutely ridiculously stupid and dangerous. But if you're a young girl, you've spent a lot of money on your hair, you're going to work, do you really want to put on a crash helmet that 4 or 5 other people have worn already that day? You're not going to. So they take the risk, they accept the risk. So what we're trying to do there is to produce or to support producers of cheap crash helmets. So a young girl will not only have a handbag and make sure her hair looks good and that, but and an umbrella, she'll also have her own crash helmet.
Right.
So it's things like that. Small businesses or the motorbike riders encouraging the use of PPE in that case that will make such a difference. I mean, motorbike fatalities now are the greatest cause of under 30-year-olds' deaths in East Africa. But it's been driven through the economic prosperities just at this pinch point of rapid urbanisation plus the inability to afford travel beyond that motorbike.
In this regard, because we're speaking about sub-Saharan Africa, but if we zoom in a little bit towards the local society or the local impacts, how does IOSH position itself with regards to local partners to get to a point of success so that you can get crash helmets to individuals riding motorcycles, or create some awareness with regards to certain activities that are maybe happening on the sidewalk, or like in the video that you showed us, where the ladies who work in the quarry. How do you get to that point where you can start working on those local elements and to try and measure the success, or to measure what the impact is, and to move towards success? Who do you partner with? Who do you work with? How do you get that done?
Yeah, it's something we're really proud of. So, and again, that's multi-layered. So at the highest level, we partner very well with the United Nations and the United Nations bodies such as the World Health Organization, the ILO, the United Nations Global Compact, so and the International Social Security Association. So that gives us the ability to speak to businesses, to ministries and so forth. But you're quite right. What matters really is underneath that. So all of that promotion at the highest level is great, and we're seen as the voice of the profession, so it's important for us to do that. What really matters is how that cascades down in a country. So we do seek collaborations as well, because our role is very narrow in terms of OSH within a broad system of economic development, finance, business skills and so forth. You can't just fix one part of the system, you have to support it all. So here in Africa, we work very closely, for example, with many of the governments, but at a tactical level with institutions such as Commonwealth Business Women Africa, who are a group of amazing, highly experienced business women that are now investing heavily in mentoring and providing networks and finance for micro businesses of those women that need it most, such as what you've seen in the documentary films we've seen today. So they're the business women, they're the ones that can provide the finance. What we will do is, as the finance comes in and they start to expand their productivity, we'll make sure that they're trained safely in the new skills they need to earn more money, things like that.
Okay. Are there other ways and means how health and safety companies or consulting types of firms, many of the representatives here come from those types of organizations, that they can also get involved with you, with IOSH, to assist with some of these programs and to work towards, successful or successes in terms of making, people a little bit safer or a little bit more aware, other than financing, some of the initiatives.
For sure. So the OSH professional network is a very broad church, as you've just said. So there are many consultants amongst our own membership as well as Saiosh here. That are excellent consultants. That one of the things that we work hard with them, for example, is how do you get in the boardroom? How do you influence corporate policy, and what does that mean in terms of, as we said in the presentation this morning, towards ethical OSH ethical OSH procurement from the supply chain, which then reaches those at most risk. So there's a role for consultants to make sure the right structure is there in an organisation, both from a policy perspective and organisational workflow and job design perspective. And then the traditional OSH inspectors, if you will, crucial as well, because that local engagement with the workforce is really, really important. The worker is the best leading indicator that we have around OSH. The OSH professional knows what to ask and what to listen out for to make sure that worker is confident and and being asked the right things to be able to flag where harm may occur, not where it's just occurred.
So there's definitely a space for everybody to
100%.
play a role if they wanted to,
Yes.
which I think is amazing.
Yeah.
My last question for you, if you don't mind. Are there any specific objectives or goals that IOSH has for South Africa in the near future? Anything that we could be on the lookout for?
Yeah, very much. I mean, we've worked hard, and thanks to Saiosh, for many of our trainings to be part of the CPD scheme. We're yet to really promote them to the point where people are using them enough. And we've got some great materials. We'd love to have conversations with academia and with the training institutions, the specialist training institutions, to see how we can help advancing the knowledge and the skill base of the great OSH professional network that's in South Africa. We desperately need connections with universities, colleges and training providers.
Awesome. I'm really looking forward to that because I'm quite eager to see what kind of materials and information you'd like to share with everybody else as well. Thank you very much for your time.
Thanks
and
for allowing
again,
me to
thank
be
you
here.
very much for an awesome presentation this
Thank you
morning
so
as
much
well.
again. Thank you.
Thank you.